Good morning. Thanks for joining us. I hope you've been having a good week. We were just discussing as we were waiting for all of you to come on that this is a really timely conversation to be having this morning, given that on Friday, submissions commenting on the Human Rights Act review close. Is that something that's on your radar as an organisation? And we know that there is opportunity through the review to strengthen the rights of children in the Human Rights Act. So this is a great conversation to be having this week, and it's a real pleasure to be joined by some great panel experts that we have for you today. So if I haven't met you before, my name is Stacey de Calmer. I work here at the Queensland Council of Social Service, or QCOS, as you probably know us. And it's a real pleasure to be hosting this session today, along with my colleague Amy, who will be facilitating the second part of the session. And this network meeting is co-hosted between the Research and Evaluation Network and the Quality Collaboration Network. So most of you will have been part of either one of those networks or have been attending both of them as the years have gone on. I'd like to acknowledge that I'm on the land of Yagara and Turrbal people today and pay my respects to their elders past and present. I want to acknowledge their continuing connection to this place, to these waterways, to this land and to this community, and pay my respects also to the Turrbal people of Central Queensland, on whose land I was born and raised myself, and the Yugambeh Nation, on whose land I raise my family these days. If you would like to share the land that you're on, I encourage you to do so in the chat. We really like to see the breadth of the land of the different nations that we come from across Queensland, and occasionally interstate as well. So I encourage you to do that if you would like to in the chat. Thanks, Amy. Now, a bit of an overview of the day that we've got, the session that we've got planned out for today. We've got so much to cover that we've actually broken the session into two parts. And first, we're going to be delving into ethics in research with children and young people in the community sector. We'll be hearing from Dr. Elise Hilder and Angela Young. We'll have a chance for some questions there. We don't always get to all the questions, but we will do our best. So as you're listening, if questions come to you, really happy for you to put them in the chat, and we will do our best to get to those, or they may be covered in some of the speaking that's happening today. We'll have a very quick break because we know 2 hours is a long time to be online without a break. So a quick break for toilet, drink, whatever, a stretch, whatever you need to do. And part two, we'll be delving into recent research, data tools and projects involving children and young people. And we'll be hearing from Bronwyn and James. And again, a chance there to be asking questions as well. At the very end, we'll have a very quick update on resources, forums on Teams and other ways that you can keep connecting with your colleagues who are on the line today. Okay, now what you all came to do is to participate in this network. Very quickly, I want to give an overview of the Research and Evaluation Network and the Quality Collaboration Network, the two networks co-hosting today. So for the Research and Evaluation Network meetings are open to everyone, as they're about sharing resources and collaboration, but it is mostly relevant to social service staff in the research and evaluation roles across the sector. There is a terms of reference for this group, and the aim of the group is really to deliver a community of practice that promotes collaboration and sharing of knowledge in relation to evaluation methodologies and measurement tools. And this network adopts a strengths-based participatory focus. It leverages, draws on and values current knowledge, expertise and capabilities that exist within the sector. And this network has grown astronomically I've watched it grow over the last couple of years. There's so many people in this sector doing great work in research and evaluation, and very generous in sharing their learning with one another. Very similar to the way that the QCN operates, which is a network that I have been chairing for a few years here at QCOS, and my colleague Kelly also assists with this. The Quality Collaboration Network is an enormously generous peer network. It began as a grassroots community sector network that QCOS got involved in sharing many years ago now, with a great emphasis on supporting one another, particularly small and medium organisations, for anyone who is in a quality or compliance focused role. We do a lot of troubleshooting together as a group, and we too hear from different speakers who have relevance to quality and compliance issues, trends, and otherwise across the sector. So we will have some more information about upcoming meetings at the end of this. Thanks, Amy. Now, this is the part you've all been waiting for, introducing Elise and Angela, two women with brilliant expertise in their areas of focus. So we'll be hearing from Elise first. Dr. Elise Hilder is a research officer at the Create Foundation. And the Create Foundation, if you are not familiar with, they're the national consumer body representing the voices of children and young people with a care experience. Now, Elise has degrees, and I don't know how she's fit this all in, but she has degrees in history, education, visual anthropology, and photography. She has worked in a variety of settings, including cultural heritage, priority languages support, first languages of Australia, children's services, and as a lecturer and researcher in the fields of art history, photography, and museum studies. I think she's the kind of person not only would you love to work with, but have at a dinner party, because she would just have so many different areas of knowledge to share and interesting things. I'm going to hand over to Elise now, and I will introduce Angela when it's time to hand over to her. So we've got about 20 minutes with Elise. I'm going to do my best to time keep, but as I mentioned earlier, being able to, if you would like to share your screen now, Elise, that would be great. Being able to pop your questions in the chat is a good idea as we go along. Over to you, Elise.
Hi there, just checking you can all hear me?
Yeah, we can.
Excellent. Thank you for that lovely introduction. So my name's Elise and I'm a research officer with the Create Foundation, and I'm here today to talk to you about the unique experience of young children and young people in the out-of-home care system. So by the out-of-home care system, I mean young people in residential care, foster care, kinship care. They could also be in semi-independent living or independent living arrangements, and then permanent. In Queensland, we've got things like permanent care as well. So that's the cohort of young people that we work very closely with at Create. But before I go any further, I just want to acknowledge the traditional owners of the lands in which I'm coming from today, so the Yagara and the Turrbal peoples of Mianjin, and I want to pay respects to elders, knowledge holders, community leaders, and families, and I want to add there the young people themselves as being knowledge holders as well in this space. Importantly, in the out-of-home care sector, I also want to acknowledge that First Nations hail from the oldest living culture in the world, 65,000 years of continuous knowledge and experience, raising brothers on country and community. And lastly, also to acknowledge that the Child Protection System today is a system based upon a history of colonial violence, dispossession, racism, and ongoing intergenerational trauma. So I just really want to acknowledge that before I proceed. Also, before I jump into research with young people, I just want to share this testimony with you from, now this is a 25-year-old, not so much young person anymore, but we work with children pretty much from early years up to the age of 25. So just to flag that, we have a broad range of age categories that we have the privilege of working with. I'm 25 and I don't see an end to the trauma from my care experience. You could give me a compensation payment and it wouldn't be enough. I want my childhood. I would have been safer being in my family. I wouldn't have been abused and moved to over 180 homes. My spirit was dampened and it will always be trapped. That's the trauma of it all. We will always carry it with us. You never have the answers. Family can't give you that. DCP won't. Health workers can't. Who can? Where's the beacon of hope? The position of power needs to be focused back onto the best interests of the kids. So, I mean, I shared that there to give you an example of this is what data is for us. This is an example of lived experienced data. But it's also, the reason I do what I do, that Create does what it does. And it gives you an idea of the sorts of experiences surrounding the young people that we interview and talk to. Not all experiences, I just want to flag, are this experience. The experiences in the out-of-home care system are very diverse. Some are positive, some are not positive. So just flagging that as well. So just briefly, I thought I'd talk to you a little bit about what the Create Foundation is and does. We're a systems advocate, so we work with young people for young people at sort of the policy and practice guidelines, policy and law level. We don't so much work one-on-one with individual cases, but we do work with young people to build an advocacy strategy that we can take to those decision makers. We have a connection focus, we've got an empowerment focus, and we've got an advocacy focus. So we're a kind of unique environment where a lot of our research subjects we have in our what we call Club Create database. So it is like a club. When young people enter the out-of-home care system, they do have the opportunity, if it's flagged to them, that they can join Club Create, and they get a whole series of resources. They have a community that can surround them. There's events that they can go to, training sessions. So down to empowerment, the empowerment focus, we actually are really not just interested in researching young people, but also empowering them to step into those roles as well. And it's a gradual process. So we have what we call Speak Up, which is SUP training, where we're essentially, for those young people interested, we're training them to be, work with us and be the advocates one day themselves. So our advocacy focus is on improving policy, practice, services, law, and also to increase community awareness about, what young people go through in the out-of-home care system and, what is the out-of-home care system. So we highlight what is working, what isn't working. We promote best practice. We have conversations with decision makers. We report back to government. We target policy, we target practice, but we also engage in, on occasions, the academic realm. So where we actually publish papers, conference papers, publish books, submit and have published journal articles as well. So there's that more formal aspect of research that we engage in. And then we have a family of contributors at Create. So advocacy and influencing team is where I sit as a research officer. We're supported by an amazing media and communications team to help us disseminate our research findings. We have a national team, which is where I sit. We've got teams in every state and territory in Australia. And we're also amazingly informed by a panel of young consultants. So we answer to the young people. At the moment, it's called the Influencing Committee, but that name is currently being changed because our young people didn't like the name of it. So we've given them the choice to change the name of this new committee. So that's sort of our family, how we work. Where the research goes, I'll get to the research in a moment, but where it goes to government. We produce supplementary resources with every report we do. So it's young person friendly, it's, carer friendly, it's practitioner friendly, it's government friendly, and it condenses down quite large, amazing research we collect from young people that goes into quite large reports. Then we also provide resources to accompany that. Publications, as I've mentioned, and then our research goes into submissions. Stacey was mentioning a submission coming up Friday. So we actually use all the information that we collate from the young people goes into our submissions, feeds our position papers, goes to social media. We have magazines. We have young people friendly magazines and older young people magazines. So what we find from our discussions with them, we feed it back to them. We have a segment online called You Said It, We Did It. Snap That Stigma, those sorts of things as well. So it's a massive driver for us to have that feedback loop that includes the young people and the research as well. And of course, once all this information is out there in the ether, we monitor it. So we monitor whether reforms and improvements are actually taking place in the system, and we call it out if it's not. So this is what our research looks like. So on the left, you've got our more formal academic research, and on the right, informal and non-academic. So the ones I'm going to briefly touch on today, because we simply don't have time. I'd love to talk about this all day, but so I'll give you an example of a research publication, a conference, and a consultation report, and then I'll just quickly show you what the others look like. But for us at Create, thinking about this topic and what I wanted to convey, and I guess 4 key points, 4 key priority areas when working with young people ethically in this space is, one, we have this motto, which I'm sure a lot of orgs share the same motto, that young people are the experts in their own lives. So it's all about centering their voices and working with them and lifting them up as well to be advocates. So it's called lived experience data. That's the research we work with. And we always record young people's voices verbatim. Verbatim is, word for word how they say it. We don't change the way young people talk. We don't try and couch it in adult or academic terms. We basically verbatim. We record exactly what young people come to us with and how they say it. The only instances where we may censor is if it's a potentially defamatory. So if they, identify an individual or organisation, we then, use our professional integrity there. Young people help us to identify our key priority topics and issues. And young people, we have a panel of young people that come in and workshop the questions before they actually go into the survey to make sure that they're, young person friendly and that they're meaningful questions. And then we take key messages, themes, calls for actions from young people. And in our reports, our actions section is actually based on what the young people have said, supported by a little bit of supplementary research, literature reviews, but it's framed around basically what the young people have asked us for. The second key priority is safety and wellbeing. So engaging with young people safely, we have ethics and consent processes, which hopefully I will get a chance to show you, disclosures and duty of care processes, trauma-informed practice, cultural safety, flexible structures to how we interview young people and engage with young people, provision of support, i.e. if they need a support person, checking in and following up with young people during and post speaking with them. And also, all of this takes place through rigorous staff training before anyone starts working with young people in this space. Number 3, reaching as diverse a sample as possible. So we're lucky at Create that we have a Club Create database where we have contact details of the young people who have joined Create. So we can reach out to them. We can cold call, or we can filter based on data we have. So if it's a research project about residential care, then we can filter in our Club Create database the young people who are currently or in the past have been in residential care. But we also reach young people through, expressions of interest on our website, social media, events, and also if we're working in partnership with another org, a university, or a fee-for-service commissioning body, they will often bring in people, the young people that we're going to be working with and interviewing. And lastly, meaningful data exchange and the feedback loop, which is what I mentioned before. So making sure that all of this information is going somewhere that's going to affect change, but also that it's being fed back to young people as well, that you said it, we did it, and integration into publications and campaigns. So just to give you a look, I'm just checking my time, just to give you a look at what some of the research avenues are for us here. So this is a Create Foundation conference that is for young people and practitioners to meet. and to share stories and share best practice best practice ideas. It's called Voices in Action. A lot of the material that we get from workshops and breakout sessions at these conferences are amazing, and we sort of do a thematic analysis of the content that comes back, and those themes then feed into what our new research topics are going to be, and then we take those to I'll explain that in a moment. I'm jumping the gun. But so we have conferences that we run, but then we also have conferences that we attend. So that testimony right at the beginning of this presentation that I shared with you was actually from this awesome co-presented conference paper that I was lucky enough to be able to do with one of our First Nations young consultants. So that was there was only maybe one or two of us who actually had young people that were co-presenting a paper at that conference, and that was flagged at that conference. So that was an amazing experience for this young consultant, and it was all an amazing experience for other young people at this conference to see a young person with a lived experience commanding that stage and commanding that space. Best practice guides, that's something else we do. And these are some example of our research publications. So these were big national surveys. And I just wanted to mention here that our ethics process at that more academic formal end is different to our ethics process at the more informal end of research. With a big project like this, where we spoke to 325 young people, we had to go through not only informed consent from the individuals involved, but also ethics. We had to go to ethics approval from an external human research ethics committee. We had a First Nations board member part of the research team. Questions were reviewed by SNAKE and young people with a care experience. And we also had a cultural advisor that was on hand during data collection and analysis. So I just wanted to flag that our big research projects have a slightly different ethics process. And lastly, what I want to spend a couple of minutes on is talking about the consultation reports, which are our bread and butter that we're doing all year round. And we are now in a position where we're negotiating with states and territories to be able to publish these on our website. So this is what we call a consultation service agreement. As an organisation with every state and territory in Australia we work with, we report back to them on how young people are faring in their jurisdiction through the form of this consultation. So I'll just quickly go through this. The service agreement is what I'm referring to here, where the young people say at the conference have this really hot topic they want us to explore. We take it to government, negotiate with government, and then we come up with a topic, and then we formulate a SurveyMonkey via the SurveyMonkey platform. We formulate a topic. Our young consultants help us with the shaping of those questions, and then we run with that. So that's a service agreement. A fee for service is where an external body approaches us and commissions us to run with them on a topic that they already have. So processes, we create the survey. We get internal ethics. So this is looking at appropriateness of participants getting consent and staff training as well. We test our surveys and review them with young consultants and staff. And we recruit. And in the recruitment phase, we do individual needs assessment of each young person. Data collection, so we record young people's responses. We have a various range of styles of questions. We like the open-ended questions because that's where young people really have the opportunity to share their stories with us. Data analysis, we do statistical and thematic analysis and literature review. And report writing. So that looks like a typical report with the background results, relevant literature, but recommended actions at the end is always actions that have come directly from the voices of young people. We provide accessible supplementary resources. So at the bottom on the right, that image is an example of a resource that we provide, which basically condenses really big reports And you probably can't see it too well. We've got a few stats, but we also have a lot of quotes. So a lot of direct testimonies from young people in that resource. And that resource is disseminated to young people, stakeholders, government practitioners. Young people we talk to.
Sorry, Elise, I'm just saying, you got 5 minutes.
Thank you. So young people we speak with for these reports are generally 12 to 25, a minimum of 25 participants. And you can see here that we look at a range. These are the range of topics in the last couple of years that we've explored. Sorry, I'm going to have to go through this quickly, but this PowerPoint will be made available to anyone who wants to look through it more in depth in their own time. When talking with a young person, so when looking at interpersonal skills and, breaking down concepts, making sure topics are user-friendly, child-friendly, we've actually talked to young people about what it is they want out of the interview experience. And these are suggestions that they've given us, which are pretty, common sense, but we embed them in this staff training package, which normally I deliver. So before anyone works with young people in this space, we have trauma-informed interview technique training. As an organisation, we also have disclosure training, cultural awareness training, and diversity training. Equity inclusion. So these are the sorts of factors we need to consider in terms of inclusivity and expansiveness in our research process. So disability support, language barriers, cultural barriers, learning styles, neurodiversity, gender and gender expansiveness, and trauma experiences. And these are the ways in which we tackle those in training of how to provide the best, most holistic, comprehensive support for these young people. Visual aids, prompts, alternative modes of delivery, such as in Zoom, over the phone, online, and always having inclusive and expansive terminology. So keeping people safe, this is my last section. Hopefully I can get it done in time. Informed consent is from the young person. Carer consent is if, or caregiver consent is if the young person is under 18. And other actions is we do an individual needs assessment. We have the option of providing them with a support person. We always do regular wellbeing check-ins during the interview and offer follow-up sessions or check-ins with the young person the next day, the next week, because often we do have access to these young people through our Club Create database. This is the beginning of the survey. And this is a sort of a zoom in of the sorts of things we talk to them about what the survey is about, and also here that it's confidential, that you can withdraw at any time, you can have a support person. All of these things are outlined to them before we go through the consent process. So they're informed participants. In line with our strategic plan, and also in light of the fact that over 40% of the care population identifies First Nations, we have a very strict policy around how we engage in the interviewing process from a cultural safety and inclusion point of view. So offering a cultural support person if needed and requested, having young people and young consultants who identify as First Nations reviewing the appropriateness of our questions. And our surveys also have branching functions in them. So if you identify as First Nations, it'll branch off with a series of supplementary questions as well. And of course, cultural safety training. And the last issue I want to touch on is trauma-informed practice, disclosures and duty of care. So like a lot of people working in this space, a disclosure is different to duty of care, but if either of these are present, our process is that first of all, the interview stops immediately. Safety check-in, so is the young person in a safe location with access to support services? If it's a duty of care issue, we may need to develop a safety plan with them and basic actions agreed with the young person. Or it may require a report to police or child protection, and that is covered before the consent process in that introduction, that we do flag that if you do express, imminent harm, that we have a, obligation to report that, and they're made aware of that before they begin. The young person is absolutely supported if they want to stop, if they want to withdraw, but also the option if they want to come back another day. Something might trigger them, and on that day, it's a no-go, but they're happy to come back in a couple of days and finish the survey. So that is quite common that happens. And then lastly, we have a process where we alert the state team, the disclosure officer, complete the disclosure forms. I think I got there.
Magic. Oh. You did really well there, and you covered everything so really, really well. Thanks, Elise. And such practical, and this across these networks, the fine balance we're always trying to get is, that expert content mixed with that practical application for organizations. So you really did well to cover off on all of those points. Thank you so much, Elise.
No worries,
I'm excited to be checking out the best practice guides. Some of the documents on Create Foundation's website look brilliant. So we will be sending all of you Elise's PowerPoint slides, as she mentioned, so you can have a look at there in greater detail, some of the content she was covering, but also any kind of important links or resources that she would like us to share with you as well. Thanks very, very much, Elise. And so we don't cut Angela short of any time, I'm going to introduce Angela quickly and hand over to her. If you would like to start sharing your screen, oh, there you go, you're onto it. Angela Young is the Executive Director for Aboriginal and Torres Strait Islander Engagement at Children's Health Queensland. Angela is a Kalali Koa woman who brings a wealth of experience to her role. Angela is committed to creating a more innovative, culturally safe and engaging healthcare pathway for Aboriginal and Torres Strait Islander children, young people and their families. She's also worked as the General Manager, Policy and Research for the Queensland Aboriginal and Torres Strait Islander Health Council. And in this role, she advocated for improving the health of Aboriginal and Torres Strait Islander peoples. She has a passion for justice and holds a Bachelor of Laws and started her career as a government lawyer. She's also held senior roles in the areas of Aboriginal and Torres Strait Islander wellbeing, employment and engagement. Thanks so much, Angela, and over to you.
Thank you. I really need to change the bio. It's quite long and a little pretentious. Hello, everyone. Yes, my name is Angela, very proud Kalali and Koa woman. So first and foremost, I'd like to acknowledge country. I'm also coming to you from Yagara and Turrbal lands, and I pay my respects to their ancestors, those who are resting in the dream time now, and those who continue to work with us, and of course young people who are emerging, who I have the absolute luxury of working with at Children's Health Queensland. So I would also like to say a little bit about my history in working with translating research into results for Aboriginal and Torres Strait Islander children. Most of my learning actually happened during the 4.5 years I spent at the Queensland Aboriginal and Islander Health Council, and learning how to provide optimum care and use sophisticated evidence base and consultation in the correct way with Aboriginal and Torres Strait Islander communities through the Aboriginal Medical Services Network. And that is in fact where I had the pleasure of working with Amy here, who's invited me here today. So a lot of the work that I do now at Children's Health Queensland is actually centred on the very tough lessons I learnt in the Aboriginal medical services and hearing them from community themselves. So for me, I always come from a framework of community-centeredness, and in the Aboriginal and Torres Strait Islander community, the children and young people are the key to cultural futures and are the key to connecting to past. So for us, it is all about Aboriginal and Torres Strait Islander children and how they want their story to be told, and how we can use that in a safe way to translate into results without causing further harm. Now, you might be surprised at Children's Health Queensland, which is a Queensland Health Hospital and Health Service, I probably once a week will get asked the question, why specifically the voices of Aboriginal and Torres Strait Islander children? Probably once a week. So why are we focusing on this particular community and not other communities of minority or other vulnerable sections of the community, or just children in general? Shouldn't everybody have a voice? Why are we focusing specifically on this community? And it seems a really sad state of affairs that I have to continue to demonstrate the deficits experienced by Aboriginal and Torres Strait Islander children specifically. And in Queensland, We know that half of the Queensland Aboriginal and Torres Strait Islander population, or 45%, so not quite half, are under the age of 19. And a whopping 33% of Aboriginal and Torres Strait Islander people in Queensland are under the age of 15. So we have a very young population, and a population that absolutely needs us to be able to curate results for them through ethical research. So I put a few stats up there. None of those would be surprising and shocking to you. And Elise, I just wanted to say what an incredible framework of support you've built for young people, and particularly culturally respectful framework for your Aboriginal and Torres Strait Islander young people. That's really impressive. So, health equity at Children's Health Queensland. So it's good to orient our organisation and what our commitment is to health equity for Aboriginal and Torres Strait Islander people before I share a couple of examples with you. A couple of years ago, I'm not sure how many of you know, but actually in our previous role at Quake, we advocated for health equity legislative change in the Hospital and Health Boards Act, where we changed the legislation to mandate that every hospital and health service needed to have a health equity strategy specifically for Aboriginal and Torres Strait Islander communities, and it needed to be co-designed with Aboriginal and Torres Strait Islander community members, their representatives, community-controlled stakeholders, and the workforce within Queensland Health. So an incredibly groundbreaking legislative change. And then I had the luxury of moving into Children's Health Queensland to be able to build that health equity strategy. So a wonderful example of a huge research piece with children, their families and young people all over Queensland, because Children's Health Queensland is a statewide service. And we were able to narrow down on these 6 key priority areas. And we spent a lot of time working with communities all over the state to tell us what they expected to see from hospital and health services in Queensland Health when they were to visit there for care. Our health equity strategy is a little different to the other hospital and health services. Because of my training ground in Quake, I didn't shy away, as Elise said before, from the verbatim feedback that we got from communities. So our equity strategy actually has the direct quotes from parents and families and their children about what they expected from their care providers when they went to a Queensland Health facility. And we stuck to that and really pushed our executive and board to allow us to trust the voices of the lived experience that we really needed to listen to translate into results. So if you get a chance to have a look at our equity strategy, you'll see it's a little different to other government strategies that are focused on these areas. The other thing that we did differently within my first couple of months, I'm now 4 years into the job, first couple of months, we recognised who actually is the leader in healthcare for Aboriginal and Torres Strait Islander people, and who is closest to the ground in working with consumers. And it would be no surprise to all of you that those are community services, not actually government services, who think they are on the ground with all of the people that they serve, and we all know that they're not. So within the first month of my role at CHQ, we entered into a service level agreement with the community control providers for the South East, which is our Queensland Children's Hospital catchment, and that's the Institute for Urban Indigenous Health. Now that service level agreement is quite different. We actually committed to co-commissioning, so we have co-funded services between us and IUI. We committed to sharing data. So we are about to, this is probably speaking out of turn, so this nice private meeting of 60, we're about to commit to sharing our access to our IEMR, which is our electronic medical record in Queensland Health. We've been able to get DG approval to allow community control sector to access that database so that we can have shared health journeys for all of our patients that see both us and community control sector. We have shared workforce. So we have a couple of teams of staff who are actually IUE and CHQ staff members. Some of those are clinical and some of those are project officers. And that allows a seamless connection between community services and government services, which is of greater benefit to our consumers, of course. And the other thing that we're doing really well is participating on shared research. And we try to research, and particularly evaluation and impact, for all of these sort of models that we're building together that haven't been done before. One of those is institutional racism audit. So a few years ago, an external provider funded by Quake and Queensland Health did an audit on institutional racism on the 16 hospital and health services, and it was fairly groundbreaking as far as community-driven advocacy goes, and it revealed that hospital and health services all over the state, shockingly, had a really, really huge issue with institutional racism across 5 key domains. That was completed in 2017, and essentially it was published. It did spur a lot of action on behalf of policy change, but actually what didn't happen was hospital and health services didn't take those audit results on and turn them into action. So during my time at CHQ, we've actually adapted that matrix into our governance schedule, and our board, through our internal audit team, now does an institutional racism audit yearly and receives quarterly recommendations from our audit team, not from our equity team, but from our standard internal audit function that recommends what needs to change within our organisation to reduce incidents of institutional racism. Now, that audit was built again with the community controlled sector, and we have a paid Aboriginal and Torres Strait Islander consumer group. So any of the changes that we make under our equity strategy have to be endorsed by our consumer group, which is a group of parents who've participated in the services at CHQ in the past 10 years, who support us. We meet quarterly, and they helped us build this audit in conjunction with the community controlled sector and some of our Aboriginal and Torres Strait Islander workforce. And it forms the kind of baseline for equity at CHQ, which is why I shared it with you. So the results of that audit told us what we needed to do to provide better care for Aboriginal and Torres Strait Islander children, and our data and analytics team built a dashboard, which it needs a whole presentation on its own. The dashboard is really excellent. Every single Aboriginal and every single staff member at CHQ, no matter what their role or what their level, has access to the dashboard, and that's deliberate. We want every person at CHQ to understand their role in providing better care for Aboriginal and Torres Strait Islander children. The institutional racism audit plus the feedback from our health equity strategy actually builds the performance indicators that we use on the scorecard, and again is reviewed and is part of the governance structure of our consumer group and our health equity strategy steering committee. So what are our guiding principles? Of course, again, the training ground that I received in the community control sector permanently etched the IATSIS code in my head, and the 4 principles of doing research with and for Aboriginal and Torres Strait Islander people. You must have self-determination in every process. You must have leadership by Aboriginal and Torres Strait Islander people in every research project, no matter how small or how large. There must be impact and value, and not impact and value for the researcher or the organisation that's doing it, but the impact and value has to be through the eyes of the Aboriginal and Torres Strait Islander people who are being researched. And of course, sustainability and accountability. So whatever action you choose to build has to create sustainability for that community, and you need to be held accountable for it over time. We also make sure that we stick to the NHMRC principles of ethical research for Aboriginal and Torres Strait Islander communities, and we have made sure that those principles are etched in our research governance framework at CHQ. So no research, regardless of whether it's clinical research or whether it's translatory or evaluation or impact research, is able to be approved by our research committee without demonstrating that they have stuck to the governance principles. And those two, the IATSIS code and NHMRC ethical standards, are in our governance framework, which is excellent. We also have a research strategy that has called out quite bravely and honestly that we have work to do in terms of Aboriginal and Torres Strait Islander health equity and research at CHQ. So unsurprisingly, a hospital and health service has not always paid attention to the unique needs of Aboriginal and Torres Strait Islander people in research. So we have done a lot of work in reshaping our strategy and making sure we have a deliberate focus on Aboriginal and Torres Strait Islander-led research, building our community of First Nations researchers, and then also creating translational impacts into our models of care by the research that we either sponsor or lead. One of our organisations at CHQ, which some of you will probably know and have worked with, is the Centre for Children's Health and Research, which is the beautiful building right next to our hospital. And we spent a lot of time with the researchers that we have in that building, reshaping this strategy and educating them on the specific needs of Aboriginal and Torres Strait Islander people. So I'm just going to give you a couple of examples of some really different pieces of research. This is specifically about our clinical trials. So after working through our strategy and identifying that actually we really weren't doing enough in terms of having a good Aboriginal and Torres Strait Islander research community, or focusing specifically on the Aboriginal and Torres Strait Islander people that we did have as part of the projects that we were leading, I spent some time with our Director of Research to talk about Aboriginal and Torres Strait Islander clinical trials and, general clinical trials that have Aboriginal and Torres Strait Islander participants in it. And at the beginning, which is about 4 years ago, actually, we weren't even able to articulate the participant's ethnicity, which again, you might gasp, someone's just spat out their coffee, I believe. But actually managing this data in a way that is useful and actually prioritise the needs of different ethnic groups is actually fairly new. So we spent some time with our research team to try to unpack the data that they did have and tell a story that gave us an opportunity to understand what we didn't know. And we're really excited now to recognise that actually 7% of the participants on our paediatric clinical trials do identify as Aboriginal and Torres Strait Islander, which is pretty close to the population, which is 8.1% of Queensland's population are Aboriginal and Torres Strait Islander young people. And you will see from that graph there that it usually correlates to the particular disease burdens that have an impact on Aboriginal and Torres Strait Islander people specifically, and unsurprisingly, a large group of our clinical trial participants are in our oncology clinical trials. But it is, in a really sad way, an exciting representative figure for our clinical trials. It's often Aboriginal and Torres Strait Islander people are not recognised well enough in some of that clinical research. So to finish the presentation on a really strengths-based approach, in building health equity responses at CHQ, we always take a principles-based approach to getting the views of Aboriginal and Torres Strait Islander people and use that incredible participatory research to make change. And the first one of those was when we actually built our co-design health equity strategy. It was a key principle that we would be building it with children and young people, and of course their parents, to make sure that we were providing a safe and trusting environment for young people to tell us what they needed when they came to our services. And this could be one of my favourite days at CHQ. So we came up with this really unique way to work with children and young people and try to understand what their priorities are around health. And so we, of course, did their favourite thing, which is drawing. We had several drawing and painting consultations. And at that consultation, we had, so that is Tony Albert, an incredibly internationally renowned Aboriginal artist who agreed to donate his time. And children in one of the workshops, we have some social and emotional wellbeing staff on hand in case the young people felt that they were particularly upset or traumatized or triggered by any of the content that they were sharing. We also had all of their parents in the room, of course, and we had a member of one of our evaluation research teams to make sure that she was building a really nice, rich database about what children wanted when they came to care. And I actually had to walk out a couple of times. So I got a bit teary by some of the things that they put down. There were some really traditional pieces of art. So there were apples and love hearts and food and sport, lots of footballs, lots of fish and things like that. But there were a couple of really insightful examples from some children who've lived away from home for a really long time. And one of those was the little girl that you see in the red and white striped shirt. She spent a lot of time to draw a series of houses. And I thought they were beautiful. It's not uncommon for little kids to draw homes. And she had this whole stretch of houses. And when our evaluation team sat with her and said, "Tell us a bit about your picture today, Georgia." And she said, "I am happiest and I feel healthy when I'm with my community." And that kind of language we kind of expect from, you know, our 20 and 30-year-old staff, or in fact, those older teenagers. But it just demonstrated to us actually that children as young as 5, like little Georgia was, actually can identify that a key element of their health is in community. So it was a really wonderful way to build an evidence base for our equity strategy. This is our most recent example. I think Amy is going to share the story of this in the chat if she already has. We recognised through a lot of feedback we were getting from our community that we didn't really have many culturally safe places and spaces of care at CHQ, and that families really wanted to go somewhere to sit and heal and have some time to be with their families when they were with us. Because we're a statewide service, we have a lot of people that come from all over the state, and sometimes their first time in Brisbane, they don't have the opportunity to connect with country or community when they're away from home. So we heard that feedback, and we worked with some of our research project team to talk about what can we do to translate that feedback into action. And really, really pleased to say 2 weeks ago, after 18 months of working with a co-design team, which included parents, consumers, workforce, and our community control partners, we've just launched our Jimbalung 9 Bar, which is a family sitting place. So we have a dedicated Aboriginal and Torres Strait Islander family lounge, which has Aboriginal and Torres Strait Islander art from the start all the way to the finish. Every piece of furniture in there and every piece of fabric was also procured from Aboriginal and Torres Strait Islander businesses. All of the toys and books in there are all Aboriginal and Torres Strait Islander toy companies and authors. So we now have this beautiful place where families are able to come and sit and heal. And we also have active research in this place because there is a survey function as part of being in the space, where we want people to give us really live feedback about what they want it to transition to, or what they used it for, or how they felt when they were in that place. And that survey function is open to all patients at CHQ, not just Aboriginal and Torres Strait Islander people, because we want to know if general population is actually feeling more engaged with our culture by being in this space, because of course one of our goals is to create cultural understanding. And the last example I'll zoom through is our core ethos at CHQ for our whole paediatric community is the concept of dreaming big. Every year at CHQ, we stop for a whole week, and the whole week is dedicated to dreaming big about paediatric care and how can we innovate in the way that we deliver care to children all over Queensland. And this year we had a fantastic opportunity to ask the children themselves about what they wanted us to dream big about. We used some of our funding at in my health equity team to provide $10,000 to a team at CHQ who could come up with the best way to quickly create a safer place for Aboriginal and Torres Strait Islander young people to receive care at CHQ. They had to do a pitch to us with an expert panel of people who were the experts in Aboriginal and Torres Strait Islander paediatric care. And over 6 months, we were able to work with young people to give us their ideas about actually what that panel should be. And unsurprisingly, the children told us they wanted children to be the judges. So we got some of our long-term patients at CHQ. We paid their families for participation in this really exciting opportunity, and we've given the young people some resources for school and things to be able to do when they can leave us, hopefully sometime this year, both of these patients. So there's a picture of our 2 young judges who were surprisingly incredibly tuned in to the needs of their clinical counterparts all across the hospital, and they chose culturally safe toys for our occupational therapy department for 2025. So we look forward to taking those 2 young people on as future executives at CHQ in the future. So really, really quick overview of how we centre the voices of Aboriginal and Torres Strait Islander children at CHQ, being led by our community control partners and being led by the consumers themselves, including the children, young people, and of course their families, and the principles that we're guided by in order to do that. So hopefully I kept to time.
Very close enough, Angela. Thank you so much. And to Elise as well. Both of you have provided such a rich overview of how your respective employers and organisations actually approach centering children's voices, that methodology and those founding principles that inform the way that you do your work, and that comes through very clearly in that those on the ground ways that you actually unfold that research. So thanks so much to both of you for sharing your insights. And I just had a big smile on my face as you were talking, Angela, because I thought, I'm so pleased that you're working at Children's Health Queensland, because what an impact and how insightful your work is, and the work that you're leading there. So yeah, great work to coming out of both your teams, Elise and Angela. Thanks so much. Now, questions. We do have time for questions, which, it doesn't always happen, but it's happened today. So we've already got one in the chat that I'm going to go to, and that's from Janine, and it's for you, Elise. It's just asking whether or not young people are paid for their information and time that they contribute towards Create's activities.
Yeah, great question. And they sure are. It was just one of those things I didn't have time to include. But yeah, so we always provide I'm not going to say monetary compensation, because it's more about value. It's letting young people know that we value them, we value their time, and the time that they give up to share their stories with us. So every project, even now, so I mentioned we had an influencing committee. The young consultants on that are also paid a wage as well to be and we have like a sort of a process of recruitment where they go through, like for the influencing committee, it's like it's almost like a job application for them. And for us, it's like, promoting that idea of getting them life ready with life skills and entering the workforce. So they actually go through that process. And yeah, they are paid a wage, and they are valuable members of the organisation. But for the interviews, yes, every young person who participates in the interviews or YAGs, Youth Advisory Group sessions, we do provide them with an e-gift monetary voucher. Yeah. Thanks, because I was actually thinking that I should have mentioned that, and you've asked the question, so I appreciate it.
Thanks, Janine. And that is one that organisations often have questions about, the practicality of how we do value people's time and their contributions, their insight that they share with us through these different projects. So that is a really important one to touch on. So any other questions? Actually, what I might mention in relation to that, and it isn't specifically around children and young people, but the last one of the previous meetings we've had this year, when we had some speakers from MIFA, the Mental Illness Fellowship of Australia, they shared actually some of their a policy or a guide they had around paying people for their contribution. So that's just coming to my mind then, that might be a useful resource for anyone who's working in an organisation that hasn't actually set up a process or a policy around that and is exploring how to do that. They have done that work, as many organisations have, but they have developed a public-facing guide to assist others to do that too. I believe theirs was around valuing lived experience. Yeah. Now we are going to actually break, and if you do have any other questions, please put them into the chat. We are going to have a break. So this first part of the session has really provided some grounding information around what do researchers think about when conducting research with children and young people. Can we centre the voices of First Nations children in particular, and young people, in culturally safe and rights respecting ways? And we've also had to think about, what does respecting children and young people in research and evaluation actually look like? And Elise and Angela both provided some really practical examples of how they both do that in their work. After we come back from the break, Amy, I'm handing over to Amy from the QCOS team, who is going to facilitate a session that looks at the recent research, data tools and projects involving children and young people. And we'll be hearing from Bronwyn from Mission Australia, and James from QFCC, Queensland Family and Child Commission, who will be sharing some of the tools and methods that they actually use in their work, conducting surveys and similar work to what Elise and Angela have spoken about this morning so far. So please don't go anywhere. Grab yourself a cuppa, have a stretch, a quick break, and we'll be coming back to start at 10:35. So we've got 6 minutes. We've given an extra minute, which is a bit of a miracle, but we've snuck it in there. Thanks again to Elise and Angela for your time. And again, we'll be sending out some resources of Angela and Elise's presentation. So don't go anywhere. We've got some more information coming up, and I'm very quickly oh, Rosalind, you said, what was the name of the organisation? Oh, MIFA, M-I-F-A, Mental Illness Fellowship of Australia. Now, we're very familiar with them because we're lucky enough, QCOS, that MIFA is actually co-located with us in our office for many, many years. So that's why we're quite familiar with their work. Now, I'm going to quickly pop in the chat before I run off a bit of information about the Human Rights Act review, because as I mentioned earlier, I think that many organisations who are focused on centring the voices of children and young people may also be interested in the Human Rights Act review in Queensland. QCUS has prepared a template to assist organisations who would like to make a submission. If you don't have capacity to or don't want to make a submission yourself, but would like to share with QCUS some insights or a story or anything that may either evidence the value of the Human Rights Act in your work or areas where you believe it could be strengthened through the review, you're welcome to get in touch with our team and let them know. So some information there in the chat. Thanks very much. I'm actually popping off now for another meeting, and I'm handing over to Amy. So really lovely to spend the last hour with all of you, and I'll see you next time.
Thanks so much, Ange, and Stacey, and also Elise. Yeah, I'm going to duck to the bathroom too. So just before I do, yeah, as Ange said, I had the pleasure of working with Ange directly for a few years, and absolutely the most incredible leader and boss. So thank you, a big thank you from me for stepping in for today's presentation. And I'd just really like to acknowledge your continued excellence in the sector and supporting children and young people in First Nations communities. So I will be back in 3 minutes to chair the next session. I'll just turn off my camera and mic, and I'll see you all very soon. Hey everyone. Well, I'm back. I hope everyone has had a quick duck to the bathroom. And we'll keep going, and thank you all for continuing to stay online today. So this is the first time we've done a 2-hour session with the Quality Collaboration Network and the Research Evaluation Network, so it's all a bit of a trial and error to see how we go. But yeah, thank you for staying online, and again, thank you to our first 2 guest speakers for that amazing introduction to thinking about how we centre the voice of children and young people in research and evaluation and advocacy. So for those of you that don't know me, my name's Amy Dellett, and I'm the Data and Reporting Analyst in the Research and Policy team at QCOS. And I coordinate our Research Evaluation Network webinars in our online forum. So today I'll be chairing the second half of the session. So the second part is really about talking about current research, data tools and projects involving children and young people. So it's really more about the doing, I guess. So we've heard about what we should consider when we're capturing and centering the voice of children and young people in our research and evaluation practice. And now I really just wanted to highlight, with our 2 guest speakers are talking about recent research and data tools and projects involving children and young people. So we will have, again, 20 minutes for each speaker. I'll introduce them and then hand it over, and we'll do a quick Q&A at the end of the session, as well as I'll highlight some upcoming opportunities that you may like to get involved with. So we have Bronwyn Boone online, and I wonder if James is online yet or not. But I'll introduce Bronwyn first, and then I'll locate where James is, and we'll try and keep to time. So It is my pleasure to introduce Bronwyn. With more than 12 years experience in the research and analytics space, Bronwyn leads the research and insights team at Mission Australia. The team conducts a range of research projects and analysis to increase Mission Australia's impact, providing insights into areas of unmet need, and is responsible for the Youth Survey, the largest online annual survey of young people in Australia. So I'll stop sharing my screen and I'll hand it over to Bronwyn. Thank you very much for joining us.
Excellent. Can you see my slide there, Amy?
Yes.
Excellent. Thank you. Well, thank you for the introduction, Amy, and I'm so pleased to join your meeting today and present to you about all things Youth Survey. So I am going to talk about some of the processes that sit around conducting the survey, how we manage the duty of care that we have to the young people that complete our survey, and of course, show you some results. This will give you an idea about the type of questions that we ask and what young people told us in 2023. And it will also, and I'll also talk about the topics that we're exploring in 2024. First, though, I'll give you some history and context about the study. Some of you may have come across it before, but some of you might not have. So yeah, let's launch into that first. We've been conducting the survey for more than 20 years at Mission Australia, and it continues to be the largest annual youth survey of young people in this age group in Australia. We conduct the survey to give a voice to young people aged 15 to 19 years, so that's our age group. It provides them with a platform to share their experiences, their concerns across a range of topics. It's used as a reference point for change, and results can act as a springboard for more effective conversations and engagement with young people around topics that we know matter to them. Being relatively new to this role at Mission Australia, I have been blown away by the reach of this research, by how many schools, organisations, government departments, community groups, media outlets and academics engage with the research. It truly gives young people a chance to be heard and for their collective voice to reach the decision makers in Australia. We are in field for 2024 now. We opened in early April and are about halfway through our fieldwork period. We close in mid-August. So I'll share with you now some of the nuts and bolts of how we conduct the study. And I thought a good way of doing this would be to run through the annual project lifecycle. As I mentioned, it's conducted annually, and it really isn't a month in the year where we aren't doing something associated with the youth survey, though there are peaks and troughs in terms of our workload. As you saw, we're in field from April, but there is much to do to prepare for fieldwork in the months prior. From about November, we start preparing for the next survey. We finalise questionnaires, we seek ethics approval for the research project, we prepare information sheets for schools, organisations, parents, young people, we put together consent forms, an engagement strategy and a communications plan to reach all of those different stakeholder groups that we want to once we launch. We seek participation for the study via a number of avenues. So Mission Australia services get involved. They encourage our clients in the age bracket to participate if they're interested. We also work with local councils and other organisations that work with young people, but schools are really the big one for us. We work with public, Catholic and independent schools. So in this period, we're also seeking research approvals from state and territory departments of education and the Catholic education officers across Australia. As we're putting together the survey, we take different things into consideration in terms of how we update and evolve the survey year to year. This year, we'll be conducting a youth consultation where we'll ask young people various questions about their experience completing the survey. So topics around accessibility, language, the types of themes that we're raising in the survey and the survey length. We'll also consult with some of our internal Mission Australia stakeholders who work with young people to ensure that their experience and expertise is also wrapped into updates that we make. So once we're at the end of March and we're ready to launch, emails go out, the media launch happens and fieldwork starts. So we're in field for close to 5 months. We are in field for such a long time to give schools and organisations plenty of time to sign up and schedule the survey into their work plans. While we're in field, we conduct the risk of harm process, which I'll come back to and discuss in more detail in a moment. But from about this time each year, we'll start to prepare for report writing time. We undertake preliminary analyses to get a gauge on what young people are telling us and if there are any new themes coming through in results. We also start coding open-ended responses. So we ask a range of free text questions and we code up quite a few of them. So it's important to start this process early, given the thousands of responses that we receive. In mid-August to the end of September, we have a really busy time writing, analysing the national report, and then it's designed, reviewed, media release is coordinated, and publication happens. So it is really important to us that we publish quickly, that we share back results in a really timely fashion to surface the experiences of and concerns of young people that year. We release national and state reports at this time. We also give schools and organisations that participate the opportunity to receive individualised, tailored and complementary reports that collate results of their young people. So we supply these reports to groups that receive more than 100 responses. You can see in these screenshots that there are various questions. Well, almost all of the questions are included, aside from some of the demographic data that give the organisation or school result compared to the state or national result. We have had good feedback from these reports. A school let us know last year, for example, that the report was used to help inform a unit of work for PDHPE students around mental health and wellbeing, sharing back results with students, their results relating to some of the mental health and wellbeing questions proved to be a great springboard to open a discussion about these issues. For organisations that might receive these reports, it also provides great local engagement opportunities, so feeding this information back to young people, sharing key issues and concerns that were highlighted by their peers in the local area. As mentioned before, while we're in field, we conduct the risk of harm procedure. So during the course of completing the survey, young people might write down some details about concerns or issues in their life. So as I mentioned, we do include some free text questions. One of the questions that we ask, the one that we look at very closely, asks young people about the biggest challenge they faced in the last year and what they did to overcome that challenge. Many young people write about school issues they've faced relating to friendships or personal relationships, work challenges, health challenges, but sometimes a young person can disclose something that suggests that their safety or well-being is at risk. So at the beginning of the survey on the consent page, we advise young people that if they disclose this type of information, we have a duty of care to connect them with the best placed person to provide them with support. We have school or organisation codes for many of the responses that we receive. We also ask gender, postcode and date of birth in the survey. And using these attributes, we let school wellbeing coordinators or principals know that there's a young person who needs support. So this is an anonymous survey. The only instance that we disclose these attributes is to help re-identify a young person if we have, have to act upon that duty of care that we have to young people completing our survey. We screen responses on a weekly basis to determine the level of risk that's presented in the response. And then we identify the best placed person to support the young person before sharing information. We work with our Mission Australia Child and Youth Safety team across this process, who come with a great deal of experience in the child and youth safeguarding and practice space, and are the team that determine the steps that should be taken across this process. So to shift gears now, I'm going to share some data with you. So we'll look at results from the 2023 survey. In this section of the survey, we ask young people to list the 3 most important issues in Australia today. So these are unprompted open responses, which we then group into broader themes. Number 1 for 2023 was the environment. So it was mentioned by 44% of young people. It was also the top issue in the prior year and the second highest in 2021. So COVID was number 1 then. Unsurprisingly, a large number of responses in this category mention words like climate, climate change, climate crisis, global warming. Young people mentioned issues around bushfires, flooding, La Nina, mining, coal, emissions, pollution, words like this. Answers also encompassed issues relating to endangered wildlife, protection, extinction, waste management, recycling, things like this. Number 2 in 2023 was issues relating to equality and discrimination. So it was mentioned by close to 1/3 of young people, and common responses included words like racism, sexism, discrimination, equality. Young people highlighted discrimination against First Nations peoples, gender inequality, religious discrimination, etc. Number 3 was the economy and financial matters. So it was mentioned by close to 1/3 of young people last year as one of the biggest issues facing Australia. The most commonly mentioned phrase was the cost of living, but young people also spoke about financial security, housing costs, inflation, and interest rates. Interestingly, while the other 2 have been in the top for the last few years, this one rose quite a bit last year, and I have a hypothesis that it's likely to continue to grow into the 2024 results. And then number 4 was mental health. So issues relating to mental health and wellbeing were mentioned by a similar proportion, about 1/3. Young people spoke, many of them spoke specifically about youth mental health. So mentioned those words, or words like depression or stress. Stress was mentioned commonly, stress from school, stress and anxiety. A number of young people spoke about mental health services, so difficulty accessing them, regional and remote access issues, or lack of access to these types of services in schools. In Queensland, quite a similar mix of issues rose to the top. So in every state and territory across Australia, concern for the environment was number 1. But beyond that, there was a slightly different mix, though Queensland was in line with the national result, broadly speaking. We asked young people what the biggest personal challenge was that they faced in the last year. So I mentioned that in relation to the risk of harm process. And for young people in Queensland, close to half mentioned a school-related challenge that they'd faced. About 21% spoke about mental health challenges, and then a similar proportion about relationship challenges. And we also ask what more can be done to help them manage these challenges. So school themes relating to being comfortable to ask for more support or advice came through. They also wished that they had more understanding from teachers or parents about the issues or the stress that they face relating to school. Around mental health, there really was a call for better access to mental health care support services, or them not knowing where to go. And then being comfortable to ask people in their lives for support and advice. And relating to relationship challenges, it was quite similar. So wanting to feel more comfortable about asking those around them for help or advice, or healthcare professionals for support if that's the type of thing that they needed to manage that challenge. So I'll run through some of the other results for Queensland, which will give you a bit of a flavour for the type of questions that we ask. So we ask a range about education and employment. We ask how satisfied young people are with their studies. So you can see it's great to see that the majority are very satisfied or satisfied, with only quite a small proportion coming through in the dissatisfied section. We ask young people what they plan to do after school, and most talk about going to university, with about close to half talking about getting a job straight after school, and then travel comes into the mix as well. We ask young people how confident they are to achieve the study or work goals, and most are extremely or very confident, with just under half somewhat or slightly confident. We ask how many young people experience barriers to achieve their study or work goals. And we see that among those who do experience barriers, academic ability is at equal top with mental health. So we see mental health related challenges coming through in different parts of the survey. So it really is an area of challenge for young people across Queensland and the nation more broadly, across different aspects of their lives. Flowing on from that, we ask a series of questions about mental health and well-being, how much control they feel they have over their life, how much in the past 4 weeks they felt lonely. I'll move through some of these results quite quickly just so you can see what they are. We ask feelings about the future, whether they feel positive or negative. And then we ask about the level of psychological distress. So this is done via a tool called the Kessler-6. It asks across a range of different aspects how they felt in the past 4 weeks. We can see that most young people in Queensland and across the nation fall into the low psychological distress bucket, though there is just under a quarter in a high psychological distress bucket, and this has been growing over time. We ask questions relating to support and connectedness. So this is one of the key questions. We ask how young people feel about their community. So close to 2/3 say that they're proud to be part of their community, with a similar proportion saying that their community has the things they need to have a positive and thriving future, but less say that they have a say on things in the community that matter to them. So, it speaks to why the youth survey is an important tool to give young people the opportunity to be heard. And finally, we ask some questions about treatment and unfair treatment and discrimination. So we see that a quarter have felt discrimination in the past year, with physical appearance, race, cultural background, personal views coming in as the top reasons for this. We ask a range of other questions in the survey. Many of them remain consistent from year to year, but in 2024 we are exploring new topics. So we are asking about artificial intelligence and opinions relating to the use of AI. We're asking about vaping and e-cigarette use. We're also asking about global conflicts. We will ask about social media use too, and we're diving into loneliness more than we have in the past because we've seen that so many young people experience this to varying degrees through results from previous years. We are also asking some questions and opinions relating to AOD use, so alcohol and drug use, impact on community, and whether they have access to education and support services. And given Mission Australia's focus in the housing and homelessness space, we also have questions relating to that and questions around finances and the cost of living. So to wrap things up, as you saw, we're just over halfway through fieldwork. So if you would like to involve the young people that you work with in the study, please reach out via email. We can provide you with more information. And also get in touch if you're interested in data. So we have a range of reports, national level, state level, and more strategic reports diving into particular topic areas. So you can explore these via our website if the age group of 15 to 19-year-olds is relevant to your work, or email us if you can't find what you're looking for. But thank you, Amy, and thanks once again for your time today.
Thank you so much, Bronwyn. I love how all of our speakers are so on time today. It's amazing. I don't know how we managed that. We've got quite a few questions coming through the chat, but we're going to hand over to our last guest speaker first, and then we'll take questions and answers after James's presentation, if that's okay, just so we can keep moving with the webinar. But thank you, everyone, for the questions coming through. It's really great to have so much engagement. So I would now like to welcome our last guest speaker. Apologies, James, if I pronounce your last name incorrectly. I'm going to try. So James DeVoe.
Pretty good. You know, I've had all kinds of things, Amy. DevRex. DevRex is probably the most Australian one.
Okay, we'll go with that. So James is the manager for analysis and insights at the Queensland Family and Child Commission. James and his team are responsible for undertaking deep system reviews of the child protection infrastructure in Queensland. Recently, James and his team delivered the Growing Up in Queensland project, which was a wide-reaching, data-driven review of what it's like for young people and their families to live, study, work and thrive in Queensland. James will cover the Growing Up in Queensland project, which comprised a written report as well as the outline interactive resource, the Growing Up in Queensland Data Explorer. So like I said, we'll have 20 minutes for James's presentation and then we'll take some questions and answers. So I don't know if you want to try, we've made you presenter, so you should be able to share your slides if you've got slides to go through.
Sure, I'll just hit the old share button there. And is that coming through for everybody?
That's wonderful. Thank you so much.
Fantastic, and thank you, Amy. Yes, I'm here to talk about our Growing Up in Queensland project, and just quickly, the Queensland Family and Child Commission, we're a statutory body that's been set up to monitor systems that impact young people and their families. And so some of the big focus areas for us are systems like the child safety and youth justice areas. We also look at other things like education and health and everything in between. So the Growing Up in Queensland project was a very ambitious thing for us as a commission to undertake, particularly as a small agency. The project itself, the first iteration was about 3 years ago, and that's where it started out as a survey of children, young people and families. we wanted to understand their experiences of growing up in Queensland. And then because that was so successful, our principal commissioner wanted to get a lot more ambitious with that and turn it into a flagship project for the commission, and to bring together as many different data sources and insights and pieces of feedback that we could as a commission to really put together a holistic picture. And part of our benefit as a commission is that we can get our hands on a lot of those different information sources that don't normally live together, and we can put them side by side. So it provides a really clear comparative benchmark for things. We wanted to have an overarching framework to guide what we did, and we settled on the Erasy Nest framework. That's it summarized over here on the right. And there's a number of different frameworks out there that we could have used, but we found this one was a fairly comprehensive way of bringing things together to divide our work. So you can see on the outside of the framework here, there's 6 overarching wellbeing goals here, and then it cascades down into different indicators to benchmark how those things are comparing. So my team will use this as our guiding light in going out and collecting all of the data and putting it together, and we've filled in as many of those different pieces as we can. And this is just some of the different areas that we've drawn information from, including the Mission Australia Youth Survey. Shout out to Bronwyn. That was really, really helpful to get that view from the young people from your perspective. But as a commission, there's 3 broad areas that we can really draw on. And one of those is bringing together a lot of the publicly available information. So places like Queensland Government Stat Office at the local level, the different departments that put out their performance reporting, as well as at the federal level with people like Australian Bureau of Statistics and the Institute of Health and Welfare. We also have, as a commission, we have statutory powers to request unpublished information from agencies in Queensland as well as nationally. So some of the information we've been able to get from the big agencies like Child Safety and Youth Justice have not been published anywhere else. And so it's a really good complement to what we've put out with the project. And the third piece is that we can also go out and collect our own information from the field. And so we've done a number of different projects over the past 12 months with field research. It was able to dovetail into growing up in Queensland, as well as we do some annual surveys as well as a commission. So we'll go out to the community and talk to them about a number of things that impact families and young people. We go out to the child protection workforce, so people like frontline workers in youth justice and social workers in child safety, and talk to them about their experiences in their job and the supports that they're getting and all those sorts of things. And we also went out and talked to parents and carers as well. And so these are people who are in the foster care system or have experience with the foster care system, and talking about the different supports that they had in place and how they felt they were being treated by the system, to pull that all together. So there's a lot of different pieces that we're able to collect for the Growing Up in Queensland project. And in fact, when it came to delivering the project, it wasn't just one thing that we were focusing on. So you can see over here, we've got the Growing Up in Queensland project as a central piece. And it was really divided into a special interest audience and the broader audience. And so for the special interest audience, we've got our long form report, which is available in printed form and also on our website as well. And that contains a real deep dive of all of the information that we pulled together, 240 pages plus, and it's really aimed at people who are involved in strategic policy and decision making in those particular systems, and people who have to make a lot of decisions around children and young people, to bring it all together and to give them a really good broad flavour of things, as well as we're running some special interests events as well, such as boardroom lunches around set topics and some webinars. On the other side, we wanted to make the information very accessible to a broader audience. And so this is where our online tool with the dashboard, the Data Explorer, came about. And that's where we wanted to have just a very interactive, environment, all of the information side by side. So people who just wanted to get an understanding of what was happening in a particular space at a broader level could come in, interact, and see everything very easily available side by side. And that's what I'd just like to give you a very quick overview of right now, which is Growing Up in Queensland Data Explorer. So shifting to the technology piece is always fraught with a little bit of danger, but hopefully this goes seamlessly. Did that work for everybody there? Fantastic. So our Data Explorer is available on the QFCC website. If you just click through to the front page, there's a big link on the front, or it's qfcc.queensland.gov.au, Data Explorer, very easy to find. The Explorer, just like the rest of the Growing Up in Queensland report, is organised according to the Erasy Nest goals. And I know there's been a lot of discussion recently around some hot topics like cost of living for young people and families, as well as housing. And so I'd just like to focus on this for the purposes of the demonstration, but there's a lot of other extra information here. So there's a lot of information under the material basics section. So we click on that one there, it takes us to the front page, and there's a bit of a summary up here. We've also got a lot of different case studies incorporated in the Data Explorer of organisations and programs that are out there that have been directed at helping families in particular with some of the challenges that they're facing in these particular areas. And on the left-hand side here, we've got the different indicators to help break down the material basics. And so if we look at financial stability, for example, in families, there's a lot of different subgroups here that help give some context around how families and young people are tracking. And so one is around the income that they're having. There's the poverty metrics, employment, and support for young people who are in care to transition. And first thing you'll notice is a lot of these things have come, if you just hover over them, you get all of the information of where they've come from. So it's brought together, as I said, a lot of different data sources. This one's come from the ABS. This one about difficulty in paying for expenses has come from our own field research that we did with our community survey. The information about the poverty line in Queensland has come from the Statistician's Office. And this one over here, well, I can't get the hover, so I'm not sure where that one's come from there. But there's the ability to get a very Queensland-centric view. So you can click on these different regions here in Queensland to see exactly what the data looks like. So for example, if we're looking at income, you can see all of Queensland, the average compared to Australia, it's a little bit lower. But when we start looking at areas like far north Queensland, and we click and we filter that one out there, you can see that that's obviously much lower again compared to the rest of Australia. So this is just a very handy way to see some of how the different regions shape up across Queensland. There's also the opportunity to drill down as well. So if I click on, for example, some of the poverty metrics here, we can also get a broader view of how Australia stands up internationally for comparison too. And somebody mentioned before, when we're talking particularly about material basics, there's the high level metrics, obviously around things like income and employment, but there's also the next level down that young people and families experience, which is things like having access to affordable food and being able to access education and the technology they need and those sorts of things. And so we've got information around these other levels here, like the food security. And again, this has come from Mission Australia, the youth report here. Access to essential items for young people. This one here, another Mission Australia one, which has been really, really helpful in putting this together. our own surveys here at the Family and Child Commission, also some TMR data as well, because things like access to public transport becomes more and more important as people are feeling the pinch with socioeconomic disadvantage. So we find in regions in Queensland where people are around or just above the poverty line, they often have challenges accessing personal transport. And so not having access to personal transport cuts off a lot of things for families, such it's more difficult for them to get to appointments, to get to work, to even go out and buy food. So things like having access to nearby affordable public transport is really important for making sure that they're able to go about their daily life and not have it too impacted. Housing was another one that factors into material basics, and particularly with cost of living. It's something that's really become a key area of pain for a lot of people across Queensland. And so, again, in the dashboard, it's broken down into a number of different metrics here. And as you can see here, it's quite concerning, really, just across Queensland, like how many families have been moving into what is termed other dwellings, such as things like caravans, cabins, tents, and that sort of stuff. And we've seen a bit of an increase in that across the years. Again, we've got the drill down on a number of these different metrics here. So if I have a look at the rents, for example, and this will not come as a surprise to anybody. If we look at how the median rents have been travelling across the different regions in Queensland, it's absolutely shot up post-COVID. In some areas, we're seeing 50+% increases in things. So across all of Queensland, it's about 13 year-on-year increase, about 30% across 5 years. And again, just looking at some of the harder hit areas like far north Queensland, where people tend to be more disadvantaged, it has been very flat for some time, around the 350 mark, and then shooting up to over $400 just in recent times. And again, coming from some of the survey work that we've done, we've seen some increases in young people saying that their families were unable to do things like pay the rent or the mortgage on time and are struggling. So all of these things puts it into context with the institutional data that's available, and also putting together with that the feedback that we're getting from young people and families to understand exactly how they're experiencing these things that are going on across Queensland. So that's our Data Explorer in a nutshell. There's a lot of other areas in here that you can drill down into. As I said, things like community safety, the health, which is a really important component of well-being, and particularly mental health for young people, is something that's also been receiving a lot of attention in recent years. And there has been quite an increase in the number of young people who are reporting mental distress, as well as families who have had challenges accessing mental health services in a timely and affordable manner. And so that's all documented there. Education's also an interesting one as well, and particularly around alternative pathways for young people who might be moving on prior to year 12 and then going on to doing things like a trade or other voc ed. And disciplinary absences is something that we've also been looking at as a commission. We've been working with the Department of Education to look at different programs there to help re-engage and support students who might be acting up at school and their behaviour might warrant a suspension or perhaps even an expulsion. But rather than just going through a very rigorous process and just removing from the system, which we agree is not beneficial for the child, is to look at other ways that we can keep them re-engaged with school while they're serving out those suspensions and expulsions. So I highly encourage you to check that out. There's a lot of information there, and also the full report is available for download on our website. So thank you all. Thank you, Amy. And do we take questions now, Amy, or all together at the end?
Thank you. Thank you so much, James. Again, right on time. So we've got a little bit of time, probably about 5 or 6 minutes for questions, which is wonderful. We've got lots of questions coming through. A lot of them are directed at Bronwyn. So given there is that many questions, we might not be able to get through all of them. Just considering your your last presentation, James, I might start with you first, if that's okay. So there's just a couple of questions. One was from Casey, asking, is the weekly income based on gross or net?
That's gross.
Gross. Excellent. Thank you. And there's a question from Beck, wondering if the data is available at an SA2 or LGA breakdown.
Not in the Data Explorer or the Growing Up in Queensland report, but that is something that we're investigating for future iterations, because some of the data that we get, the agencies don't collect it at that level, but we think that we as a commission, we can do some work to break that down to that level.
Absolutely. And then there was just a comment from Rod saying, lovely work. Thank you, James, for sharing, and love the way that you started with a theory that sensitizes you in what you look for in your work. So again, thank you very much. I'm going to now direct some questions to Bronwyn. There's one, first of all, from Alexander regarding the schools surveys. Are flexi and alternative schools involved in being surveyed? And if so, what's the engagement rate?
Thanks, Alexander. I can't talk specifically to the engagement rate because I don't have those numbers to hand, but we invite all schools that have students in our age range to participate. So yes, alternative schools have been invited and some have signed up. So that includes independent alternative schools and learning by correspondence schools.
Great, thank you. That's good to know. There's another question as well. So love the committed and sustained effort at listening to younger people. In the equity response, to what extent did participants report class or financial or economic equity? And that question's from Rod.
Yes, so I don't have the numbers to hand, but it was certainly a theme that came through for us. And on this topic, we have a report release in a couple of months relating to youth homelessness and housing, and one in September relating to cost of living challenges. So they might be really relevant to you, Rod, and answer some of those questions that you have.
That would be great. We can take those questions offline and follow up after the webinar as well. Thank you. There's some really great questions from Susan coming through as well. So they'd like to hear more about what actions or initiatives are put in place to support the low numbers. I'm thinking that might be relation to survey numbers, and also wondering about considerations for relationship issues, and as well as how Mission Australia informs the broader themes to the survey, and if there is any consideration for transitions or research that have been conducted on young adult transitions, say from school to uni.
Maybe I'll talk to Susan's question. So the way I interpreted that, and jump in, Susan, if I'm not talking to the right thing, but I thought it might be low numbers relating to some of the mental health and wellbeing results. So we collaborate with youth mental health organisation Origin to dive deeper into those results and to surface the experience of young people relating to their mental health by way of research reports. So this has resulted in tools as well. So an example is a social exclusion tool that was developed by Dr. Kate Fillier in Melbourne Uni off the back of youth survey research to be used to measure that experience across young people.
There was also a question from Mandy wondering if food insecurity has emerged as an issue for young people.
It did, and it's not been published yet, but I can give you a little preview that food insecurity emerged as an issue that you'll see coming through in the youth homelessness report, which will be released in August. So some young people highlighted access to essentials around their financial position, so not being able to afford the essentials or having to skip meals as something that they'd struggled with.
And a question from Debbie: has Mission Australia considered doing a survey for youth 12 to 14 years of age?
Debbie, we haven't. We once upon a time, long before I was involved, I think that the survey did extend from 12 through to perhaps 24, but a decision was made many years ago to narrow the cohort of interest to 15 to 19-year-olds. So that's the group that we'll be continuing to focus on for next year.
Wonderful, thank you. I think there's maybe one more question that we can ask. So question from Rebecca. Bronwyn, the youth survey is such a valuable resource. So congratulations. I'm wondering what work you do to try to reach young people disengaged or not engaged in school. It's a great question.
Yeah, so we work closely with our Mission Australia services that work with young people in our age range. So we have good engagement among our clients who are interested in participating. So we reach those young people that way. And then we also work with other organisations, so not purely through schools, so community organisations, other NGOs and local councils who have contact with those young people.
Wonderful. There's comments from Rod saying it's interesting how we can get captured by a discourse of cost of living crisis when another way of talking about what is happening is an inequity crisis. And what was the thinking there, Bronwyn, about the age?
So I think 12 to 24-year-olds have a broad, that's a very, from someone who has just finished primary school through to someone in adulthood, that's a very broad scope of age group. So yeah, I think that was the thinking behind narrowing to 15 to 19-year-olds. And it's also a group that's not necessarily covered off in depth by other research projects.
Wonderful. Thank you for covering so many of those questions. I think we've kind of got through all of them, which is great. I just wanted to thank you both again so much for your generous amount of time that you've allocated to the webinar today and, sharing your research and knowledge with us. What a wonderful panel of guest speakers that we've had. I feel so privileged to hear from you all today and just really want to express our gratitude and thanks and appreciate your enthusiasm to share and connect with our networks today. There's a whole bunch of other resources as well that I kind of came across when we were kind of thinking about the webinar today. So I thought I'd share that with everyone in the chat as well. But yeah, just a big congratulations to you both and our previous guest speakers as well on all of your work. So I'm just going to spend the next 5 minutes talking through what we've got upcoming for the network, just as a wrap up, and then everyone can enjoy the rest of their day. I'll just start sharing my screen again. Go through. For the questions. So just a friendly reminder that we also have a research evaluation forum and a QCN forum that sit within the Microsoft Teams platform. And so I can share the instructions on how you can join the forum if you'd like to continue engaging with our networks online or offline from these webinars as well. So I'll just share these in the chat with you, particularly for those people who may be new to the networks. There's a whole bunch of resources in the links that I've just shared. So you can also access our Research and Evaluation Network webinar recordings and resources on the Community Door Research and Evaluation Resources Hub page. And also, I wanted to flag that the QCOS data point is now live on the QCOS Data Hub website. And Data Point has been designed as a central location where community services staff can access up-to-date data that is relevant and meaningful to the community services sector. And on Data Point, that includes a link to the Data Explorer. And so the data sets are categorised across QCOS policy focus areas, including housing, youth justice, living affordability, women's equality, children and young people, and community services. And labour force and employment data sources are also included to support our sector for the Skilling Queenslanders for Work program. So please reach out if you have any questions or feedback about the tool. If there is any Queensland or Queensland region open data sets that you know that we can point to, please flag them with us and we can continue to update this resource as an up-to-date resource for the sector. In terms of upcoming opportunities that you may like to get involved with, so I'll share again these links to these webinars in the chat. So this is what the draft plan for the networks look like for the remainder of this year. So you can plan ahead for what's coming up on the horizon. So in August, we'll be hosting a webinar on trauma-informed evaluation. And in September will be our last webinar for the year in collaboration with the Quality Collaboration Network with a focus on responsible AI. So really interested to hear the results of the Mission Australia survey, including AI in their survey for future years. Be interesting to keep an eye out on that one. So the QCN also has upcoming meetings on data governance and benchmarking and child safe organisations and the HSQF team. For next year, the Research and Evaluation Network, we're starting to look at hosting more sessions on data visualization and data storytelling and communicating impact. And on our forum, we've also been talking about organising some lightning rounds on the research that's being conducted within the sector. So our focus has mostly been on evaluation to date with discussions today more about research. So watch that space. And then some more details with the next meeting for the QCN. So in this meeting, we'll be joined by Gabby Segura at Food Agilities as a data policy manager. And Gabby has a wealth of experience in data management and develops best practice data management policies in her role. And that webinar is on the 17th of July. And then for the Research Evaluation Network, we have a webinar on the 31st of July, where we'll have a guest speaker from Clear Horizons, who will explain everything to do with developmental evaluation and the key features of developmental evaluation, including how it differs from traditional approaches and when and how to apply a developmental evaluation approach. Just also to flag that QCOS is promoting the Info Exchange Digital Technology in the Not-for-Profit Sector Survey again this year. So the survey includes questions on data and digital infrastructure, remote working, digital capabilities and skills, digital marketing, cybersecurity, challenges, opportunities, priorities, and emerging issues and technologies for the not-for-profit sector. So it's now in its 9th year, and the survey builds a comprehensive view of the state of technology in the not-for-profit sector in Australia and New Zealand. This survey will take around 12 minutes to complete, and I've added the link in the chat. And that is actually all from me today. I wanted just to say thank you all. If you stayed online for the whole 2 hours, thank you very much. Yeah, we really appreciate your time today and engaging with the discussion. We do have some quick polls. We have had some tech issues, so apologies if the polling doesn't come up, but I'm going to try and launch them now. If not, feel free to share your feedback in the chat. We really appreciate that feedback to hear how we're going, and we really love hearing what you think of the networks and our guest speakers and ideas for the future. So I hope everyone has a wonderful week, and thanks again for joining us, and look forward to connecting with you all again in July. And have a wonderful school holidays if you're having some time off. I've got a week off, which I'm very excited about. So yeah, I'll come back in 2 weeks' time, all fresh-faced. Thanks again, all of the guest speakers. That was a really wonderful session.
Thank you, Amy, and have a good day, everyone.